often should women be getting a pelvic exam? I mean, before they come to see you, should we be getting one regularly, yearly?
So if you're a sexually active woman, you should be getting regular exams.
Okay.
The benefit of that is that there are a lot of issues that may contribute to pelvic floor dysfunction that your physician should be diagnosing and taking care of. So before you come to me, you should have those kind of exams.
Oh, so if they come to you, then we should have a list of things that might be sort of like a little red flag for our primary care, correct?
Exactly. So you go to the physician first, and if you're having urinary urgency and frequency, burning with urination, any symptoms like that, they want to make sure that you don't have any kind of infection before you come and see a pelvic floor therapist.
Now, it's important to know if you're experiencing any of these, do not be embarrassed. Have a conversation with your doctor, because education is really the first step when it comes to tackling this issue, and it absolutely can be tackled, correct?
That's right. I spend a lot of time with my patients on education because knowledge is very important. Many patients are fearful of what's wrong with their pelvic floor, partly because they don't know what's normal. This isn't something that we've talked about traditionally, and a lot of cultures treat the pelvic floor issues very differently.
Okay. Now, what exercises do you teach, Louise, so that we can better the situation?
So the Kegel exercises that we discussed are basically just tightening the pelvic floor muscles.
Okay.
So this is sort of taken out of context here.
If you need help, I will hold.
So with the pelvic floor muscles, we just contract. And if you think of using a dumbbell for your biceps, basically that's all you're doing is contracting and relaxing to strengthen this muscle. The benefit of physical therapy, in my mind, is that we take that simple contraction of the pelvic floor and we put it into a functional context. Because everybody can sit still in a chair and squeeze the muscle, but when you're jogging or exercising or lifting your baby or putting luggage up into an overhead compartment, you need to be able to do the Kegel at the same time and be able to
You want me to do a Kegel as I'm putting my luggage on the overhead bin?
I do.